As now I am inviting Miss Arya to moderate the session. She's a third year BHMS student at Adrasram Homeopathic Medical College. Welcome, Miss Arya.
Hello, sir. Am I audible?
Yes, you are audible and visible.
Okay, sir. Good evening to all the respected doctors, students, and friends of homeopathy joining us from across the world. On behalf of the International Forum for Promoting Homeopathy, I warmly welcome you all to the 1872nd consecutive day of our daily webinar. It's truly an honor to have with us today Dr. Nikunj M. Trivedi, a distinguished and inspiring homeopath, gold medalist, fellow of the British Institute of Homeopathy and Royal Society of Health, UK, and the chairman of the UK HMA. Today, he'll be enlightening us on the fascinating topic, magic of mustard in male and female infertility. Let's welcome Dr. Nikunj M. Trivedi with a big round of virtual applause.
Thank you. Thank you very much. Am I audible?
Yes, sir, you're audible.
Okay, thank you. Yes, today we are going to talk about our handy ingredients, that what we are using every day on day-to-day cooking. That is called the mustard. In Malayalam, it is, I'm sorry for my pronunciation, but it's kaduk. In Gujarati, it is called the rai. In Brazilian, it is called the nigra. So we are talking about the hidden essence of the mustard oil. So here I would like to share my screen.
Yes, sir.
Okay. So now we are going to discuss about the magic of mustard in male and in female infertility. So Dr. Hahnemann wrote in Organ of Medicine, Ode Sapere, means dare to be wise. To my understanding, for the upbringing of the homeopathy, for the advancement in the homeopathy, we have to invent a new concept in homeopathy to implement it at different level and to prove its clinical significance. And this footnote you will be able to see in a Materia Medica by William Borick, Dr. A.S. Hard, and Dr. Bartlett applied it in different way in Borick's Materia Medica. Yes, now magic of mustard. So what magic can be done with the mustard that we are going to evaluate, and how it is making a change in the patient's life, how it brings the life to patient's life. That's very, very important, and that we are going to discuss today. So mustard seed having a chemical, and that chemical is known as a thiocinaminum or rhodalin. In England, in 2003, the Southwest College of Homeopathy has published a very, very big research paper on this. They have proved a thiocinaminum, rhodalin, on many, many patients, and I got a full reports of all the research. On that ground, I'm able to talk much more about the thiocinaminum. The word mustard comes from the Latin. Must means much, and ardence means burning. That's why it is called the mustard. And some interesting fact about the mustard. Mustard was first cultivated in India around 3000 BC. It came to Britain with Romans. Mustard was first used for medicinal purpose. It was not used as a condiment initially. Mustard was used for the medicinal purpose. And if you see, if you look around us in our families, we are using mustard as a home remedies. If some wound is there, people are just apply the paste of mustard. Any swelling on the joint, people are using the mustard. Some case when patient having a shot of acidity, patient just crush it, and means people are crushing it and giving by diluting in a water. So mustard having a multifaceted, multifunctional, wide use all over the world. And in India, we are using it for tadka. So mustard is adding a flavor to the food, and that's why it is called as a condiment. France is the largest consumer of mustard in the world, and Nepal ranked the highest in its production. Now, what is condiment? Condiment is a substance, just like a salt, mustard or pickle that is used to add flavor to the food to enhance its flavor, such as seasoning, in a form of sauce, in a form of garnishing, or in a form of toppings. And condiment is a Latin word. Condimentum or condire means to season or to preserve. And that's why all our pickles are containing mustard powder, mustard seeds, because mustard having a property to preserve. So it's been widely used in sauce, pickles, paste, dressing, roasting, and marinating. So these are all about doctrine of signature of the mustard. Let us discuss how mustard, the condiment, the thiocinaminum or rhodalin, adds clinical flavors to cure the certain chronic conditions with homeopathic implementation. When I was practicing in India, and I used to get many patients with a tubal block. And many patients, they were telling that we being to one place. I was practicing Anand, by the way. And near to Anand, there is a place called the Nadiyad. Nadiyad is very famous for the Santaram Mandir, means Santaram temple. And the mother of that Santaram Maharaj was using the douche of thiocinaminum. She was putting a douche of mustard seed oil in patients' vaginal cavity. After a couple of sittings, patients used to get pregnant. This was the history that what I perceived, that what I received when I was practicing in India, and that has enlightened certain clinical significance of applications of mustard in homeopathy. So when I read about mustard in Materia Medica, that it's a resolvent, it removes the addition, it removes the fibrosis. Then I was started researching deeply into it. And when I found that it's a great resolvent, then I thought to use in a homeopathic way. And that's why here I wrote that it adds clinical flavors to cure the certain chronic conditions with homeopathic implementation. And now let us see what homeopathic implementation we have found. So to understand thiocyanaminium, let me tell that it's a homeopathic remedy derived from the mustard seed oil, primarily used for dissolving scar tissue, adhesions, strictures, and fibroids. It is very useful remedy for treating tinnitus, otosclerosis. When the tympanic membrane becomes thicker with the advancement of the age, and when patient is developing a sort of a deafness, or when patient is developing a tinnitus in the ear, thiocyanaminium is the very good remedy to cure the tinnitus. It is also addressing adhesions and thickened or hardened tissue. After burn, the skin becomes thick, skin becomes fibrosed, there is a stricture, scar tissue. At that time, the application of the thiocyanaminium orally and externally is making a great difference, and I have given a good results to my patients with a keloid. So this is used in case of lupus as well and chronic glandular tumor. When patient with rectal stenosis, if you refer Materia Medica, and if you find a arnica remedy, a ribbon-like stool, that is because of the prostate. But when we are giving a thiocyanaminium along with the arnica to the patient having a ribbon-like stool, the prostate gland becomes completely normal, patient a normal round stool, and the whole fibrosis of the prostate gland gets resolved with the help of thiocyanaminium along with the arnica. So clinical overview of mustard is well recognized for its extraordinary dissolving action on fibrous tissue. Homeopathic point of view, thiocyanaminium is an antipsychotic medicine. On pathological aspect, it inhibits microbial growth. So its importance is in pathology as well. When patient having a infection with the E. coli, Staphylococcus aureus, Bacillus cereus, it inhibits the growth of all type of bacteria. It also inhibits the growth of certain type of fungal infections and mold. Now, on clinical aspect, on endocrine aspect, on thyroid gland, the raw seeds contains goitrogens. Goitrogens which affects the thyroid function, and this thiocyanaminium having a good affinity to control the thyroid function. In female, it supports healthy ovulation when patient have an ovulatory cycle, and when we monitor the cycle with the BBT chart, basal body temperature chart, or with the ovulation strip, and patient is not ovulating exactly on the 14th day, and if you administer the thiocyanaminium in 200 potency along with the constitutional medicine, patients start ovulating normally and it becomes a healthy ovulation. It increases the fertile mucus production at the time of ovulation. When patient is ovulating at that time, patient having a mucus production, we call the ovulation discharge or discharge at the time of ovulation, which is transparent with the help of the thiocyanaminium. When patients start healthy ovulation, automatically patient having a fertile mucus production, and it also improves the endometrial linings. When it has been given externally and when it has been given internally, how it has been given internally that I will explain later on. but it has shown the improvement in the tubociliary movement of the fallopian tubes, and it enhances the transportation of the ovum, transportation of the egg. So, how it works on the female aspect. Now we are coming to the male part. In a male patient, it increases the sperm count. And when patient having a complaint of low motility or sluggish sperm, we call the asthenospermia. And low motility means slowness in the movement of the sperm. And there is a few quantity that is called the oligospermia. Oligospermia means scanty, and astheno means low motility. So when it has been given to a patient of oligospermia, oligoasthenospermia, or asthenospermia, it improves the quality of the sperm without fail. So now we are going to discuss more about on the TFI, tubal factor infertility. Do you have any question over here?
No, sir. No, sir. We can have that.
Okay. So, importance of thiocyanamino in tubal factor infertility. Tubal factor infertility is about 25 to 30% in a vital statistics of the infertility. And the female infertility with the tubal factor caused by either disease like tuberculosis, obstructions which can happen after any surgical maneuver, like patient has undergone a shot of a MTP or DNC or any surgical and we come across many patients, those who underwent MTP, medical termination of the pregnancy, at not a proper hospital. And that has not been done by a qualified gynecologist. After that, they develop a sort of a pelvic inflammatory disease, that is called the PID. Patients are getting infections with the unprotected sexual intercourse. That also leads to the tubal block. The improper surgical manipulations like DNC or MTP is also invading the infection in the uterine cavity, and that is also causing a sort of a tubal block. So here we are talking about the obstruction. This is like tuberculosis in village. I have seen that many people, they are drinking a raw milk straight away. They milk the cow or buffalo and straight away they drink the milk. So it brings the bovine tuberculosis very commonly. And with that, patient is developing a endometrial cox, endometrial tuberculosis, and that is also one of the factor of tubal block or tubal obstruction. Any damage with the hydrosalpingo, with the pelvic inflammatory disease, with the infection, if it has been damaged, with the laparoscopy also, I have seen the sort of a damage to the fallopian tube. Any scarring, say for example, patient get typhoid. With the typhoid, there is a secondary infection which goes to the peritoneum, and it also affects the fallopian tube. So, which leads to the scarring and fibrosis. And any congenital malformation or any other factor which is causing tubal factor infertility in a patient's having a infertility, and we have to evaluate that in a proper way. And when we find all these factors, out of that, if some factor is playing a role with the female infertility, we should keep thiocyanamino in our mind. It will help because which impede the descent of a fertilized or unfertilized ovum into the uterus. through the fallopian tube, means transportation, and prevents a normal pregnancy and full-term birth. Because of all these factors, disease, obstructions, damage, scarring, and congenital malformation. So here thiocinaminum is playing a vital role. So in early slide, we discuss about the obstructions, right? And the tubal factors causing 25 to 30% of infertility cases. As per the vital statistics, 20 to 30% of the infertility cases is related or responsible with the tubal factors. And tubal factor is one complication of the chlamydia trachomatis infection in women, causing a tubal inflammation leading to the tubal block. Tuberculosis, another factor which is highly responsible for tubal block along with the endometrial cocks, that what I earlier mentioned. Now, on a clinical aspect, when we are treating patients with clinical homeopathy, I always remember Dr. Leon Vanier, a French homeopath who was the first to state that in order to cure chronic diseases, the treatment must address all the symptoms of the disease at once. So we saw in the earlier slide, let me go back here. Disease, obstruction, damage, scarring, congenital malformation, and other factors we are taking into consideration. And we also consider patient as a whole in homeopathy. So that what Dr. Leon Vanier has explained, that to treat chronic disease, we must rely on clinical experience gathered by the numerous homeopaths over the years. And this approach is called the clinical homeopathy. And clinical homeopathy is very, very vital because you are giving a shot of a documentary proof to your patients. No doubt mental symptoms are very important. But simultaneously, along with the physical symptoms, the pathological symptoms are very, very important. And we have to compile everything to make a clinical picture of a patient. Then we are able to treat the patients in a proper way. And as per the Hahnemann's first aphorism, we want to restore back sick to health. So abnormal to normal. I always tell my patients that your abnormal condition will be restored to the normal with the help of homeopathy. And that is the magic of homeopathy, and that is the magic of mustard. That's what we are going to see. So this is laparoscopic view of the uterus. Can you see this uterus? These are the ovaries, and these are the fallopian tubes, right? Okay, now how thiocinaminum works on tubal block? That want. Externally and internally. Externally means, as I earlier explained, that the mother of that Santaram Maharaj, she was advising to put a douche of a mustard oil. She was preparing it and she was giving it. So that was external application. Internal application, that what we are giving a homeopathic medicine in a potentized form. Usually 3x is the ideal choice, which gives a quick result. And if there is many more complications, then we can think about the 200 potency for dissolving the scar tissue. It is also helping to enlarge gland. Enlarge gland means enlarge lymphatic glands. When there is an infection, all the lymph nodes getting enlarged. Patient get lumps. When patient abdominal infection, peritoneal infection, infection with the reproductive organs, simultaneously the lump appears in the breast because of the lymphatic drainage. when there is a stricture, when the pathway becomes narrow because of the fibrosis, because of the stricture, from here, from this is the ovary, from here, when egg wants to travel down to the uterus, means through the fallopian tube, through the fallopian tube, from ovary, it goes to the fallopian tube. From the fallopian tube, it goes to the uterus. And here it waits for the sperm to get fertilized. But during this traveling phase, this part, if this tube becomes narrow because of the stricture, because of the scar, because of inflammation, then egg remains over here. And sperm can pass from this tube and it results in an accident. Accident means ectopic pregnancy. So this is very, very important when patient complaining about the repeated ectopic pregnancy, means there is something wrong with the lumen of the tube. At that time, we have to advise patient that wait for a couple of months, show me your hysterosalpingogram. If any inflammation on the tube, if hydrosalpinx is there, if there is any other infection like tuberculosis is there, then we have to remove that first. And when you advise patient for another HSC, when patient fallopian tube becomes normal with the spillage of the dye in the pouch of Douglas, then you can give a green signal that you can try for a baby and patient will conceive without any complication. So these are the things which we should keep in mind. Anybody having any question now?
No, sir, we can go ahead, sir. At the
Okay.
end, we can have.
Yeah. So now, how we used to open a tubal block, that I'm explaining you. We had a team of doctors, one gynecologist, one radiologist, one anesthesiologist, myself and my wife. The gynecologist role was giving a position to the patient, and by putting a speculum and by putting a tenaculum, he was giving cervix, he was preparing cervix. Anesthetist was giving a short-term anesthesia to the patient so patient can get relaxed. And we used to take thiocinaminum homeopathic dilution. It gets diluted in a 20 ml of distilled water or saline. And slowly we were injecting. And now with this animation, you will be able to see that, how the medicine was reaching to the block end and how it gets opened. And after HSC, we used to check the tube is opened. When we were injecting that intrauterine, we used to feel some resistance, but gradually when we were pushing it, the block gets dissolved very immediately. And in my 25 years practice in India, I have opened more than 200 blocks, and majority patients I was getting from the gynecologist just to prevent the invasive procedure over the patient. And this is the charm of homeopathy. This is the magic and miracle of homeopathy, that this thiocinaminum, if injected intrauterine in a proper way, then it was opening a blocked fallopian tube instantly. And after that, we advise our patient to undergo a HSC. I used to do the HSC along with the radiologist, and we have seen quick result. Immediately, we can see the tubes becomes opened, patency has been established, and with that, tubociliary movement of the fallopian tube gets established, and patients were conceived within 3 to 6 months. And this is the magic of the thiocyanamide. Yes. So it's a resolvent, externally and internally. So internally we were using, and externally means orally we were giving thiocyanamide 3x to be continued morning and evening for a couple of weeks. So intrauterine use of thiocyanamide under guided sonography shows the pre-spillage in pouch of Douglas, which is suggestive of tubal patency. To confirm the tubal patency, it should be followed by hysterosalpingography or hysterosalpingogram. So this is how thiocyanamide works internally. And this is the pre-spillage. This is X-ray plate. It's a specimen, it's a sample, just to show you that when we were injecting, this is the cannula. From here, we used to inject a dye, and with the dye, when dye goes up, and both the sides, the spillage was confirming that tube has opened completely properly. In many patients, we have seen that both tubes were not getting opened, only one tube, but with the one tube also patient has conceived. So there is no necessity that both tubes should get opened. If it gets opened, good, well, but if it doesn't get opened, and if one tube gets opened, then also chances of getting pregnant for the patients are very, very, very high. And in many patients, after doing this procedure, after injecting this thiocyanamide intrauterine, the fertility parameters has been completely changed and they were getting pregnant very quickly. Yes. Now coming to the failure. In many patients, when we tried this to open, we remained unsuccessful in a first instance. So after 3-4 months, again we used to do the same procedure and patient was getting results with the bilateral spillage. I remember one patient, she's a homeopathic doctor near our area. She was 150 kg in weight. She had a PCOD, polycystic ovarian disease. She had endometriosis, polycystic ovarian disease, and along with a bilateral tubal block. And in one medical camp, one of the gynecologists has challenged me that you are talking about homeopathy very high. If you open this tubal block, means if you help this lady to get pregnant, I will bow down to you. Fortunately or unfortunately, that lady was a homeopathic doctor. Her name is Kalpana. And her husband having a medical store in that village. And we took a challenge that, okay, let us try. She was also ready. We were also ready to help her. And we injected, no success. So another very next time, after 2 months, they were again came that, can we try it again? And I said, yes. And we were unable to find the cervix because cervix has gone so retroverted. So ultimately we called another gynecologist, and she's very famous in our area, Dr. Naina Patel, and she has started a sort of a surrogacy in our area. She's very, very famous in our area. So she came, and with her help, we could find the cervix. We injected, tubes were opened, and meanwhile, very next month, I came down to London. And I was here for 2 months. And her husband, as he had a medical store. So after 2 months, she missed her period and she tried to take a pregnancy test because they were selling the pregnancy test kit in their medical store. And the result came positive. And her husband was so enthusiastic, so overwhelmed, so happy. So he came to show me the result. Meanwhile, he met with an accident and he broke his arm. So he came after fully recovery. At that time, she was 6 months pregnant. And this was the charm of homeopathy, that how homeopathy is working. If it is being well selected, it has been selected on clinical aspect, on clinical condition, and in right direction. So this all about the magic of mustard in female infertility, and we'll fix a next session for male infertility, and we'll elaborate some more cases about the male patients. They have been benefited with their oligospermia, their asthenospermia, their oligoasthenospermia with the help of only thiocinaminum. And at last, thanks to all of you for listening me and giving me opportunity to share my valued thoughts with all of you. Thank you.
Thank you so much, sir, for that insightful and enriching session. We now move on to our live interaction segment where participants can directly share their questions and thoughts with Dr. Trivedi. Please raise your virtual hands and we'll take them one by one. Is there anyone who would like to ask sir any questions?
Yeah, I'm here only to answer any questions related with the tubal block, related with the thiocinaminum. Yes, Dr. Danesh.
Yes, sir. It's really an excellent session. And you really show the beauty of the thiocinamin, that's the mustard, how it works for homeopathy. And your method is a different one also. Actually, I know homeopathic doctor think in that way that you can give this thiocinamin into the organ itself.
Thiocinamin is such a wonderful remedy.
Sir, whether you give the medicine internally, regularly, or only just doing this?
So when patient comes to you, when patient has done everything, when patient haven't found any solution, and when patient knows that patient having a tubal block, the invasive surgery never gives any guarantee that again patient having a recanalization of the tube or not. So in that case, this is a OPD procedure. This is a non-invasive procedure. This is not causing any damage to patient's organ. So initially, when we know that patient having a tubal block, so initially we start with the thiocinaminum orally. 3x potency, 1 tablet morning and 1 tablet evening for at least 2 months, minimum 2 months. And we are also observing the consistency of the menstrual flow. Here in England, I treated one patient with tubal block. I gave thiocinaminum, though patient have get tubal block, but without any invasive procedure, patient got pregnant. Within 2 months, patient got pregnant. So sometimes that block is very minute, very small, and that addition get completely resolved with the help of this thiocinaminum.
Yes, Dr. Karnagar.
Sir, I have used only potency as it is a, maybe the block is removed by pathologically clear off because of physiological dose, or you have to use the dynamic dose, sir?
Two ways. Just now I explained that initially give thiocinaminum 3x, 1 tablet morning, 1 tablet evening for 2 months. And just observe the consistency of the menstrual flow. If patient is complaining that patient having a very big clots or about menstruation is mixed with the mucus, tardy menses, dark, and then just watch the ovulation as well by giving a sort of a BBT chart. or ovulation kit. And if HSG still shows that patient having a block, then you can use the intrauterine mode of opening the fallopian tubes. No doubt it requires a lot of skill, lot of experience, and your exposure to gynecology. If you have worked in gynecology then and then you can do, otherwise don't try. This is my request.
Yeah. Can we succeed in all cases of tubal blockage only thiocyanamide, sir? What are the indications of prescribing thiocyanamide, sir?
That is tubal block. First, principal indication is the tubal block, then hydrosalpinx, and then ovulatory disorder. These are the three things you should keep in mind.
Sir,
Tubal block is-
thiocyanamide has the property of dissolving tissues,
Yeah.
whether it be inside any organ or outside the organ.
Outside also you can use that. Yeah.
Yes.
Even I had one patient, still also I'm treating. That patient is from the Preston. That patient has urethral stricture. Patient has undergone 2 to 3 times dilatation. They put the dilators in urethra. Male patient is screaming after that and scalding, burning, the typical symptoms of cantharis. And I also gave cantharis along with thiocyanamium, patient having a flow established now. No doubt that flow is very slow, but that is because of the prostatic enlargement, benign hypertrophy of the prostate.
Sir, as per your observation, tuberculosis is one of the reason for this, and then in those conditions, why tuberculum can be given in the beginning stage of the treatment? And
I always
usually we people are used to give the tuberculum in those cases, and then later we go to the constitutional medicine, and as and when it required, we used to give this thiocyanamide. This is what we people are doing here. But you have a different line of treatment. What's your opinion on that, sir?
So when patients get tuberculosis, I always go for investigations. Chest X-ray, routine blood. That means full blood count. If ESR is very high, more than 80, then we can go for other immunological test. And TB GOD is the most accurate test right now. Then I advise patient to go to the physician, get it treated first for 6 months, and then come back to me. Then we can finalize it's a tubercular myasm. Then you give the tuberculinum, it will work like a magic. Tomorrow I having a patient. I suspected TB. Yesterday I took a blood. We have sent that blood to the laboratory. We have got the result, and this Saturday patient is coming. So initially, what we are telling patient to take a AKT, anti-cox treatment for 6 months, and after that we will switch over to the homeopathy. So homeopathy will not get spoiled its name, and we are not crossing our limitation. That's very important. If somebody says that as a homeopath, why you are treating TB? Yes, we can't treat in this country.
Sir, what I meant was that usually people having a history of tuberculosis, not at the time of consultation, but he may or she have this kind of tuberculosis some part of her lifetime. And that is what the previous history is all about.
Yes, it shows that when patient has history of tuberculosis, means patient already having a fibrosis, either in the lungs or anywhere in the body. So thiocyanaminium is the right remedy to resolve that fibrosis. Tuberculosis is always causing fibrosis, always. And then thiocyanaminium along with tuberculinum. You can also give tuberculinum 1 m, 10 m dose because it has become a constitutional remedy. And then this becomes a complementary remedy. And this is antipsychotic as well. Thiocyanaminium is an antipsychotic. So both the miasm will be covered. And psychotic means overgrowth. When there is overgrowth, fibrosis also causes overgrowth of the dead tissue, scar tissue. It will be removed. So you are right in that way.
Sir, people used to say that thiocyanamide 3x titration is better than tablet. What's your opinion on that, sir?
Yes, is better. Yes. When patient having a lot of complications, loads of comorbidity, at that time you can use a potency like 200. But when there is a simple fibrosis or scar tissue or adhesions, 3x will make a magic in it. No doubt about it.
I meant what I meant was that tuberculum 3x can be given in tablet as well as in triturated powder form. The powder form is much better than tablet. This is what the people used to say about.
Yeah.
Exactly.
Because see, right now trituration is not available in this country. So we are also getting ready-made tablets from the pharmacy. So 3x pharmacy is easy to dispense. Patient has to remember that one tablet morning, one tablet evening. It looks a bit sophisticated as well. So we are suggesting tablet. But trituration, if available, then yes, it's a good way to give, good way to administer.
Sir, have you ever tried LM potency for these kind of problems?
Yes. When patient a lot of comorbidity, at that time we are using LM potency. And that is also giving a good results, but not with all the patients. Not with all the patients.
Sir, we know that the infertility rate is on the rise. And what's the situation in UK at the present situation, whether it is male infertility or female infertility, which is more than more you have noted, sir?
Reason is that is what the fecundity. It is gradually lowering day by day because of the stress, because of the preservatives, because of the dietary habits, and because of the lifestyle. These are the factors which is playing a vital role on the patient's fertility. Environmental factors in India, like inhalation of the carbon, use of recreational drugs, alcohol, tobacco. In India, people are eating this gutka and tobacco, chewing tobacco. Here, people are having a lot of alcohol consumption, preservative in a food, frozen food. All these things are playing a role on the fertility, and that's why day by day, the cases of infertility are increasing in male as well as in female. And as in my presentation, I explained that infection, PID, unprotected sex is one of the factor over here. They are not taking any precautions. And that's why many patients having a PID, pelvic inflammatory disease, HIV infection. And that's why in a school at the age of 10, they are giving HPV vaccine to all the girls. Human papilloma virus vaccine in every school, just to give a protection. And sometimes something which is not visible, but it is playing a role, like pets. If somebody having a pets like cat, dog, or some birds, right? So that is also very important to rule out the torch. That is toxoplasmosis, rubella, then herpes virus. Everything is playing a role on the fertility. Even many times, a doctor missing to check the blood group. In India, it is very common to check the blood group. Even in driving license also, you have to mention about our blood group. But here, blood group is a very rare thing that what doctor recommend in NHS. So in that case, the incompatibility of the RH, rhesus factor, is playing a role. If husband is positive and wife is negative, then the series of miscarriage happens, and at that time, anti-D is indicated. But here, blood group is not being done as a part of routine. So these are all the factors which we should consider in terms of treating infertility.
Sir, in which case of primary or secondary, in both cases, thiazide is worked, sir. have you observed any in first pregnancy as resolved by thiocyanamide? Is it possibility of happening in second pregnancy, same problem, sir? In your experience, have you observed, sir?
Basically, I'm practicing in infertility and chronic cases. So it's not a primary or secondary. You have to find a root cause. When you target the root cause and when you treat the root cause, say, for example, adhesions, right? So you have to find the cause of adhesions. Once you find the cause of adhesion, treat accordingly with the constitutional remedy and with the thiocyanamide. Thiocyanamide is always complementary. It will work as a supplementary, but you have to give one constitutional remedy along with that, as per the patient's constitution, myasm, diathesis, and thermal reaction.
It means have you used thiocyanamide as a complementary or in addition to the constitutional remedy, sir, in all cases, in your experience?
No, I'm using as a complementary, but not as a constitutional. Constitutional is always deep acting miasmatic remedy, like tuberculinum, like syphilinum. If any patient having a PID related with some infection, then we have to give the syphilinum. Syphilinum is a destructive. Syphilinum is a destructive condition. And patient having a certain thing and secondary metastasis. Say, for example, patient having a typhoid and patient had that salpingitis because of the childhood typhoid. Childhood typhoid has been treated with the chloramphenicol long back when patient was 11, 12 years old. And when patient was 11, 12 years old, patient had a mumps or patient had a typhoid in a male patient. But patient has been neglected for the orchitis. Patient has been neglected for the salpingitis. So we have to find the deep acting root cause for that. And if you find that this infection is a cause of this salpingitis or orchitis, then if patient having a orchitis, then orchitinum will be the very good remedy. But simultaneously, you have to give the
Along with constitutional remedy, we have used it to thiocyanamide as along with the constitutional remedy, we will get good results. That is the meaning,
Yes.
sir? Yeah. Thank you. How much success rate, sir, percentage of, especially in the tubal blockage cases treated with thiocyanamide along with the constitutional remedy, what is the success rate, sir?
If any patient having a sort of a corneal block, because there are two type of blocks, femoral block and corneal block. If patient has a femoral block, success rate is 90%. Corneal block, it will just cause a lot of problem to you because you have to open it 2 to 3 times. And after then also, if it doesn't open, then you have to leave the patient. Otherwise, patient will leave you.
Thank you.
Right,
Sir,
sir?
sir, what is the impact of tubal pregnancy in and this tubal block? Is there any connection between that?
Tubal block means
Yes, sir.
patient. Sorry.
Yes, sir. At times we get patients who are having this problem of tubal pregnancy, and thereafter sometimes the tube may, doctors may remove the tube, and sometimes it may not, but still persist with the tube, and that may become a block in the future. And in those conditions, what is your attitude? What is your line of treatment?
If one tube has been removed, and if patient only one tube, thiocyanamide will make a wonder on it. Because when you give thiocyanamide, it will increase the tubociliary movement. Because tube is lined with the cilia, small hair-like threads, right? On that, the egg is rolling. So with the injection of the thiocyanamide, or when patient is taking with the oral route, ingesting, it increases the tubociliary movement. It increases the cilia. Cilia becomes more healthier, and chances of becoming pregnant are very, very high. I treated that type of one patient from Nadiad. Patient had get 3 times ectopic pregnancy. And then that patient, that having a Zanka dress, is they having a shot of a ready-made dress shop, Zanka dresses. That lady has been treated by me after visiting a few gynecologists, and we have treated that lady very successfully with only one tube. So success rate is very high if you treat with a proper care, with looking to all the investigations and analyzing the things with pathological protocol. But when you feel confident, take a risk. There is no harm. Patient will definitely get benefited.
Yes.
Thank you so much, sir. I guess it's time for us to conclude. Thank you so much for that insightful and enriching session. And before we wrap up today's session, I'd like to bring to your attention to an important event. The International Forum for Homeopathy, Promoting Homeopathy, is hosting a webinar on the importance of National Register for Homeopathy by Dr. Bithi Roy on Saturday, October 18th, 2025, from 8:30 p.m. to 9:30. This is the 1874th day of IFPH talks, and we encourage all interested in homeopathy to join us, and looking forward to seeing all of you there. Thank you.
Thank you.
Okay.
Hope you have enjoyed this session.
Yes.
Because this is absolutely new concept, a new approach, but that what I was doing since past 20 years, 25 years.
Thank you, Ms. Arya. Thank you, Dr. Nikunj
sir.
Trivedi, and those who attend the session. It's an excellent moderation from Ms. Arya. Arya is doing this for the first time. She is a third year BHMS student from Adhirashrama Homeopathic Medical College. We really love you to have more sessions with us. Thank you all.
Sure.
He is brilliant.
Thank you.
Thank you. Thank you very much. Thank you.
It's over to Dr. P. Shaila to moderate the Malayalam session.